Welcome students. This is the final lecture number 8 for Nutraceuticals, in which we have discussed in the lecture number 6 about the questions which they have asked in this chapter. Here they have asked many 2-mark question and even 5-mark question about the drug interaction, herbal food interaction. So this topic states, according to the syllabus, herbal drug and herbal food interaction, study of the following drugs. They have specified some few drugs and their possible side effects and interactions, like Hypericum, kava-kava. Kava, it is pepper species. Ginkobiloba, ginseng, garlic, pepper, and ephedra. So we can see this drugs and its herbal drug interactions with the drug as well as food. So you should know about the pharmacology base of drug-drug interaction. I am just giving some glance which you might have studied very detailedly in your pharmacology. This is just a revision and also giving some definition point of view. Drug-drug and herb food interactions, which we have to discuss. This is the topic according to the syllabus. Mechanism of drug interaction, when we talk about in pharmacology, which you studied, the drug interaction can occur in several different ways, starting from its absorption up to the elimination, like pharmacokinetics from the body. Following are the various mechanisms with the drug interact. Type of drug interaction, you can see drug-drug interaction, drug-food interaction, and drug-disease interaction. Like that, a basic classification can be done, in which drug-drug interaction, more the medication administered, greater is the chance of drug interaction with each other. One drug may potentiate the activity of the other, or inhibit its activity, or serious unexpected side effect may occur. Example, Vicodin is a trade name, a painkiller which taken along with a sedative antihistaminic drug like Benadryl produce an additive effect of drowsiness. Vicodin is a fixed dose combination analgesic containing acetaminophen, paracetamol, or N-acetyl para-aminophenol, APAP, and hydrocodone. So hydrocodone is an opium derivative of non-steroidal analgesic and anti-inflammatory drugs, comes under that category. This tablets, when it is taken along with Benadryl. Benadryl contain antihistamine, is a brand name actually, Benadryl, which is, it contain a generic medicine of diphenhydramine, a first generation of H1 receptor antagonist, a commonly used OTC, over-the-counter antihistamine, effective in relieving sneezing, running nose, and itchy, watery eyes. This is another type of drug interaction where drug interact with food, beverage, and can produce various side effects. That is drug-food interaction. Drug-food interaction, the second one. Grapes juice reduce the enzyme activity in liver, which are responsible for metabolizing drugs, thus resulting in increased blood level of certain drugs, such as cholesterol lowering drugs like statins, rosuvastatin, statins. This leads to the toxic effect of the drugs such as muscle pain and muscle injury also may happen. So this is drug-food interaction, grapes juice. So it can increase and it can reduce also. So I have taken two examples. Proper dosage which a grapes juice, if it blocks the enzyme activity in the liver and so much of drug in the blood, in statin, the case of statin. When you come in other drug like fexofenadin are moved to transporter into the body cells and it is reduced actually. You can say here transporter blocked to little drug in the body so that the drug will be reduced. There the drug will be increased. So here the drug will be reduced. So both of them, drug and food interaction, when you take a grapes juice. So the grapes juice can block the action of transporter also in the case of fexofenadin. Decrease the amount of the drug in the body and may cause the drug to not to work as well. They also a derivative of antihistamine drug. So you can see the drugs can be increased their amount and also decreased by the amount by means of drug and food interaction. So this is drug disease interaction, the third one. Sometimes drug also interact with certain diseases where the disease alter the way of the drug works. It will alter the how it works. Example, oral decongestant like pseudoephedrine, phenylphrine. So phenylphrine and also pseudoephedrine may increase the blood pressure. A patient who is having a disease that is blood pressure can be dangerous to the patients having hypertension. So drug interaction can also be classified or divided like pharmacodynamic interaction, in which you can see decrease or antagonistic effect sometimes. You can see additive or synergetic effect, double the effect, reducing the effect or increasing the effect, that is pharmacodynamic interaction. Pharmacokinetic interaction starting from absorption interaction you can see, and distribution interaction, second one, and next you can see metabolism interaction, and finally you can see that excretion interaction. So it is very easy for the students to explain clearly about the drug interaction, which you have the knowledge of pharmacology, but still if suppose they are asking 5 mark or 10 mark, it is necessary for you to use this basic knowledge and to write. So drug pharmacodynamic interaction, as we are told, this occurs when two or more drug administered together acts at the similar receptor site. They are competing, leading to enhance. So additive or synergetic effect or decreasing effect also may happen. Antagonistic effect. Example, chlorpromazine give to prevent nausea and vomiting interact with antipsychotic medication like haloperidol and produce serious and possible fatal irregular cardiac rhythm can happen. Pharmacokinetic interaction, when you take, this occurs when drug interact during the process of absorption, distribution, metabolism or excretion. First, starting from absorption interaction, some drugs can alter the absorption of other drug. For example, calcium can bind with some drugs like tetracycline and HIV drug dolutegravir and block its absorption. Hence, some drugs should not be taken along with milk and antacids. Distribution interaction, one or more drug can compete with each other for plasma protein binding sites, resulting in displacement of one drug, thereby increasing its blood level, concentration and toxicity will occur. Example, fenofibric acid, cholesterol lowering agent, and warfarin is blood thinning agent, anticoagulant, when administered together, compete for the protein binding site, leading to displacement and increased blood level of warfarin. Once if it is increasing the blood level of warfarin, thus resulting in bleeding. So this type of should be avoided. Distribution interaction. Metabolism interaction, you can see enzyme in the liver such as cytochromes are responsible for metabolizing drugs and eliminating them from the body. Some drugs may alter the enzyme levels. The enzymes may not be available for the metabolism factor or its activity resulting in a fast or a slow metabolism of the drug. Example, diltiazem. It is a calcium channel blocker anti-hypertensive drug. Inhibit the cytochrome enzyme responsible for the metabolizing statin, simvastatin. That is an hypocholesteremic drug for cholesterol when you take. And it elevates its blood level, resulting in serious liver and muscle side effect can occur. So you see diltiazem and simvastatin, when you are adding, it is changing the enzyme property and metabolic interaction takes place. Excretion interaction, some non-steroidal anti-inflammatory drugs, NSAIDs you might have studied like indomethacin, may lower the kidney function and reduce the excretion of lithium. Lithium excretion will be reduced if suppose in the case both of them. A drug-drug interaction in excretion. A drug reduce the bipolar disorders may occur. In such cases, dose adjustment is required. So herbal drug and food interaction now when we talk, even though herbal medicine are obtained from natural sources, their active ingredients are potent chemicals which can give rise to herb, drug and herb food interaction. So we cannot say they may not have any interaction, they may not have any side effect. They are also very potent chemicals in naturally available. Herbal supplements and nutraceuticals are being purchased over the counter and may be labeled all natural, but does not mean that they are always safe. You should not take along with them simply any drugs. Herbal supplements are not subjected to review by the Food and Drug Administration, and their use can often be risky when taken along with other drugs or foods without the consultation of the physician. Following are the general guidelines which is given, which helps to minimize the herbal drug or the herb food interaction can be minimized. Avoid taking mucilage containing herbs like ispaghul, flakes, which contain mucilage, with other drugs such as mucilage can inhibit the absorption of many drugs. Even mucilage containing drugs can alter the blood sugar levels, which have to be considered in case of diabetic patients. Spicy substances such as ginger, capsicum, etc. can enhance the absorption rate of some drugs. So hence they need to be taken 1 hour after drug administration. Hot tonic herbs such as hawthorn is also one type of drug which is for various cardiac congestive failure, like digitalis, cactus, should be avoided while taking cardiac medications. Caffeine, coffee tea containing herbs like green tea, kola nut, coffee and herb stimulating like ephedra, herb stimulating drug ephedra should be avoided when taking heart medication or mood altering drugs or antidepressant drugs when you are taking. Stimulant drugs even ephedra, they should be avoided while taking this heart medication or cardiac medication, mood altering drugs, CNS drugs, antidepressant drugs. Hawthorn means what? Because we should know that what is Hawthorn. This is also used as a disease of heart and blood vessels such as congestive heart failure, chest pain and irregular heartbeat can be adjusted by Hawthorn. It's a very beautiful fruit and flower, white color flower. This is the tree, and this is Crataegus commonly called as Hawthorn, quickthorn, thorn apple, may tree, white thorn or haveberry is a genus of various 100 species of shrubs and trees, family Rosaceae, native to temperate region of North Hemisphere in Europe, Asia, North Asia, Africa and North America. So just you should know about the Hawthorn. Avoid herbs or formulation containing licorice. Adi Madiram, they used to have licorice, you can use. But when you are using diuretics like furosemide, cardiac patients or edema patients, if you are using furosemide, Lasix, don't take licorice because licorice can cause potassium duplication from the body. Kalamia may take place, hypokalemia may take place. So while taking antidepressants like monoamino oxidase inhibitors, avoid African aphrodisiac herbs like containing yohimbine for erectile dysfunction or libido increasing drugs. Sometimes yohimbine, when you are using, you should not take monooxidase inhibitor drugs. Green leaves like broccoli, spinach, cabbage, etc., which have high vitamin K content, are reported to interact with anticoagulant drugs, as vitamin K has coagulation promotion effect or promoting effect. Grape juice, already we have discussed, interact with the calcium channel, antihypertensives, lipid lowering drugs, psychotic medication, oral contraceptives and anti-allergic medications. Grape juice modify the metabolism pattern of these drugs in the liver. Study of some of the common drugs and their interaction, where we have added, according to the syllabus, they are asking for many questions, so we have added some of the drugs. In that you can see this plant, yellowish flower, very beautiful flower, which is known as Hypericum perforatum. It is called St. John's wort. St. John's wort means Hypericum perforatum. Don't forget, remember this. It is a popular herb used in the treatment of mild depression. The active constituents of herb is known as hypericin, which has similar effect on the brain as that of monoamino oxidase, MAO inhibitors, antidepressants. If taken together, it may produce dangerous drug interaction, resulting in rapid rise in blood pressure, severe headache, collapse and death. So they should not be taken along with the St. John's wort or Hypericum perforatum. You should write that very clearly. Foods like cheese, chicken, liver, fish, legumes, soya sauce, beer should be avoided, should not be taken, should be avoided with this drug, especially with Hypericum perforatum, which is used for depression treatment. It's a very good drug. Hypericin has also reported to produce interaction with immune suppressant drugs like cyclosporin, antiviral drug, indinavir, oral contraceptives, digoxin and benzodiazepines, resulting in increased sensitivity to light, anxiety, dizziness, dry mouth, fatigue, and sexual dysfunction. So it is completely having an opposite action. Hypericum perforatum, known as perforate St. John's wort. Common St. John's wort, and St. John's wort is a flowering plant and its family is Hyperaceae. St. John's wort, Hypericum perforatum, a plant that grows in wild, has been used for centuries for mental health conditions. It's widely prescribed for depression. So we can remember what is its action, what is its contraindication, reactions. Now we have to write about kava. There is question also, kava-kava. Kava is Piper methisticum. It is not Piper nigrum, it is Piper methisticum, family Hyperaceae. It's having a little tippily, that means it is an herb that has anti-anxiety, pain relieving, muscle relaxation, and anti-convulsant effects. Kava or kava-kava should not be taken with the drugs which acts on nervous system such as barbiturates, antidepressants, antipsychotics, and alcohol. Should not mix up with kava. It is reported that concomitant use of kava-kava or kava with the central nervous system depressants can increase the risk of drowsiness and motor reflex depression. Kava has also reported to produce hepatotoxicity effect when taken with some drugs. Piper methisticum, which is called kava or kava-kava, is a shrub of large leaves of South Pacific islands used in traditional medicine to treat fever, respiratory problem, convulsion, and urogenital problems. Now it's an important one, Ginkobiloba, maiden hair tree, family Ginkobiloba. Ginkobiloba leaf was such a different, it looks like golden after changing but greenish color initially. Ginkgo has been used to treat symptoms of Alzheimer, dementia, Parkinsonism disease, and to enhance the memory capabilities. Ginkgo is reported to decrease the antiviral effect of drugs used in HIV such as Ephedra and Idinavir. Ginkgo can also alter the action of drugs metabolized through liver such as omeprazole, fluvastatin, and donepezil. Ginkgo biloba or Ginkgo biloba, also called maiden hair tree, delicious, gymnosperm tree, family Ginkgoaceae or Ginkgoaceae, native to China. Ginkgo improves cognitive function, brain clarity, increasing thinking power, function, because it promotes good blood circulation in the brain and protects the brain and other parts for neuronal damage. That's why it was very much useful for Alzheimer, dementia, Parkinsonism disease, which are having the relation in the brain. Neurotransmitters, dopamine, acetylcholine, these all are responsible, and serotonin. So you can see they improve the cognitive function. This is the Ginkgo fruits and the leaves and the tree, the beautiful tea. Ginkgo should be avoided in patients who are on anticonvulsant treatment, blood thinner, and anti-diabetic drugs. They should not take Ginkgo-biloba. Ginkgo is reported to interact with more than 250 drugs. Hence, patients should be taken proper consultation with a physician before using it. Ginseng, Panax ginseng. We have discussed in the last class also about this one, about its details. It was a very good drug for erectile dysfunction in the male and many nervous system. It is ginseng is one of the important drug. Ginseng is used to improve the body resistance to stress, boost in immune system, and improve the sense of well-being and stamina. It is also used to improve physical and mental performance and treat erectile dysfunction, hepatitis C, symptoms related to menopause, lowering of blood glucose, and controlling blood pressure. Ginseng is reported to induce the activity of enzyme cytochrome P3A in the liver, which metabolize various drugs, resulting in their decreased activity and foster excretion from the body. Ginseng decreases the effectiveness of warfarin, blood thinner, anticoagulant, and increases the risk of clotting. Hence, it should be avoided while taking anticoagulants. Ginseng, we have seen already the picture ginseng. Beautiful flower, but we need the underground roots and the rhizome. Ginseng is also reported to decrease the activity of anti-hypertensive, resulting in high blood pressure. It is also reported to affect the activity of anti-diabetic drugs, hence should be avoided in such cases. Ginseng is the root of plant in the genus Panax, such as Korean ginseng is available, South China ginseng, and American ginseng, typically characterized by presence of ginsenosides and gintonin. Garlic, we have already discussed. Garlic is also having some adverse action and interaction with the other foods and drugs. Allium sativum. Garlic is used in various conditions like to lower blood sugar level, reduce menstrual pain, lowering blood cholesterol levels, and decrease blood pressure. Garlic does not interact with drugs at normal recommended doses. However, exposed to concentrate of the garlic extract, if it's more for prolonged period, it is reported to interact with several drugs. Garlic is reported to reduce the efficacy of the drugs. Some drugs, those distributed or distribution is depend on the efflux transporter mechanism. Garlic is reported to affect the blood clotting, hence should be avoided in patients taking blood thinner agents like aspirin and warfarin. Garlic alters the blood sugar level, hence used under supervision on patients with antidiabetic treatment, antidiabetics. It is also reported that garlic supplements have decreased the blood level of HIV protease inhibitor when used together. Piper nigrum or pepper is also, they have asked, family Piperaceae. What is its reaction with various drugs and foods? Black pepper contains piperine as a chief active constituent. It is used as a species as well as carminative and to treat arthritis, asthma, stomach upset, and sinus infection. Piperine is reported to inhibit various cytochrome enzymes, resulting in increased blood level of certain drugs such as carbamazepine, midazolam, diclofenac, phenytoin, and warfarin. Black pepper might increase the risk of bleeding when mixed with anticoagulant like warfarin or aspirin or bleeding or blood thinning drugs like aspirin, clopidogrel, heparin, and warfarin. Black pepper might produce additive effect with anti-diabetic drugs and increase the risk of hypoglycemia to the patient. Black pepper might increase the blood level of cefotoxin or cyclosporin, resulting in increased the drug effect as well as the side effects. Black pepper might also increase the blood levels of thereby enhancing the effect as well as side effect of anti-cancer drugs, antihypertensives, anticonvulsants, and some antibiotics also. Ephedra. They have asked 2 mark question many times. Ephedra Girardiaceae. Ephedraceae. You should know about the family Ephedra and you have studied more detailedly in the last semester itself. So I am just giving some points. Ephedra is used to treat allergies, hay fever, and respiratory tract conditions like bronchial spasma, asthma, and bronchitis. Ephedra contains ephedrine, which is a potent drug that stimulates heart, lungs, and nervous system. Overdose or improper use of ephedra result in various effects like high blood pressure, heart attack, muscle disorders, seizures, stroke, loss of consciousness, and death. Ephedra may reduce the effectiveness of antihypertensives and could raise the blood pressure. Ephedra should not be mixed with other central nervous system stimulants such as amphetamine and its derivatives, as it may enhance the hyperactive and produce serious condition. Ephedra should be avoided with blood thinning medications such as aspirin and warfarin, as it may induce bleeding. Ephedra may interact with antidepressants like imipramine, clomipramine, morphine, and monoamino oxidase inhibitors and enhance their effects. Ephedra should be avoided in people suffering from seizures, as it may worsen the onset of seizures. That finishes your chapter of nutraceuticals. Revise and study detailedly and prepare your notes and make yourself comfortable and see the question paper whichever I have told in the lecture number 6. Thank you.